Start off with the disability etiquettes. Different kind of instructions are given by different bodies. So handshake is recommended. Confidence of that person is important to look them in the eye. But the problem is that you should not do that. But etiquettes say that you should not pretend that you understand. So medical checkup, if you conduct medical checkup, that way you will get to know physical improvement. Obviously it will improve their physical strength or physical health. Help with altering that sport. Hello everybody, my name is Rohit. I take physical education on behalf of Prep School by Vidhyaashram. In today's class, we will cover the final session of our chapter Physical Education for C.W.S.N. That is the session number 3. Now, if you haven't seen the first session and second session of this chapter, I recommend you go back and see that session first and then come back and try to continue this session. Because in this session, I'll be cross-referencing a lot of things that we studied in the last few sessions, and then at that time you may get confused or certain thoughts or concepts may get skipped through your mind. So to avoid that, I recommend you go back and watch those episodes or sessions first and then come back and continue this session. Now having said that, let's move on with our third session and try to understand what all topics we'll be covering in this particular session. So first, we'll start off with the disability etiquettes, okay? So what all etiquettes you must follow with the people who have any kind of disability or disorders, okay? So we will be studying about different kind of etiquettes that you must follow with a person who has different kind of disability and disorders. Next, we will look into advantage of physical activities for children with special needs. Okay, C.W.S.N. The chapter name has C.W.S.N. element in this. And what's the abbreviation for that? And what's the expansion of the abbreviation? You have children with special needs. Okay, so we will look into advantages of different physical activities for children with special needs. And after that, we'll look into different kind of strategies to make physical activities accessible for children with special needs. Okay, so having said that, let's move on with our first topic in the whole session, that is disability etiquettes. What all disability etiquettes you need to follow? First thing is, don't refer to any person with disability as retarded or disabled or handicapped. That's one important thing that you need to know. At many places, at government places also, at many government organizations also, they have changed the label from disabled section to specially abled. Okay, so that is one thing that you need to know. You should not address a person with any kind of disability or disorder like a retarded person or a disabled person or a handicapped person. That is the first etiquette that you must have. Second is that handshake is recommended. Okay, don't try to hug a person or don't try to greet a person in any other ways. Handshake is recommended with people who have any kind of disorder or disability. Next, when you see a person or when you meet a person with a visual impairment, always identify yourself and others who are with you or who may be with you. Always when you meet a person who have any kind of visual impairment, you should not touch that person or pat on that person or give a handshake or start touching them. It is important to know that you have to identify yourself. You have to tell them. You have to tell them who you are, you have to introduce yourself, and you have to introduce if somebody else is with you to that person, and then you have to wait for that person's response, and then you have to carry forward the conversation. Because since they are visually impaired, right, they are not able to see the things around. If you suddenly go and pat on them or if you do a handshake or anything, they may suddenly get scared or they may suddenly get any kind of problem with that. They may face a lot of problem because of that. So that's another etiquette you must follow. After that, leaning or hanging on a person's wheelchair should always be avoided. So person who has again any kind of disability with limbs, they use wheelchair, right? So person who is using a crutches or people who are using crutches or any kind of wheelchair, you should avoid leaning onto them or sitting on the hand of the wheelchair or using that wheelchair, because it's a disrespect to them. Okay, so you should not do that. That's another etiquette you must follow. And after that, always listen carefully as well as be attentive when you are having a conversation with a person who has difficulty speaking, because you should understand that the person who is having difficulty in speaking, already he is struggling to speak. Already that person is struggling to speak, to put on the conversation out, to say something to you. On top of that, if you ask that person to repeat a sentence or repeat what they said, it may piss them or it may cause a trouble to them. So that's another etiquette that you must know. After that, you must also know that when you're talking to a person who is in a wheelchair or a person who uses crutches, keep yourself at an eye level, keep your eyes at again to eye level. Maintain that eye level, it's important. You should not look down, you should not look at the wheelchair when you talk to that person, you should not look at the crutches. It's important for you to maintain the eye level with that person, so that person also doesn't feel any weird or any weaker. Okay, because when you are talking to that person, and again if you're looking at the crutches and looking at the wheelchair when you're talking to that person will feel that person will remember, and that person will notice that you're looking at the wheelchair, and that will remind him his disability. That may again reduce his confidence, or it may cause a lot of mental questions and things like that. So to avoid that, to keep the motivation of that person, to confidence of that person, is important to look them in the eye and talk like you talk with anybody who doesn't have such a situation. Moving on to next, to get an attention of a person who is a deaf person, okay, to get an attention of a person who is a deaf person or having hearing impairment, tap the person on the shoulder or wave your hand. You should look directly at the person and speak clearly, okay. So person who are deaf, no matter how much you call them, they will not hear you, okay. They will have hearing impairment. If that person has any kind of hearing impairment, you have to tap them and again make them realize that you're calling them, or make them realize that you're about to speak something, and you have to speak directly at their face, looking at them, keeping your head straight. Why is that? People who have speaking impairment, they are taught or they learn to understand other normal people who don't have such impairments, to read whatever they say by the lip movement, okay. So many people get that training of reading the lip movement. So certain people who have hearing impairment try to understand certain points by lip movement. So if you look down and talk, that person may not be able to understand what you're telling. So it's important to look that person in the eye and talk. And when you start the conversation, when you initiate the conversation, before that you should tap that person and you should call that person first and ensure that that person is paying attention to you. After that, the next one is that never patronize a person who use wheelchair by patting them on the head or shoulder. That's one important etiquette you must follow. A person who is again sitting on a wheelchair or using any crutches, you should not patronize that person on a head or shoulder. You should not pat that person. Basically that's the meaning. You should not pat, or you should not say anything to that person in such a way by using such means, okay. So that should be avoided. That's another etiquette you must follow. After that, always introduce yourself to person who are blind using your name. Start off with your name. Any conversation that you're going to have with a person who has visual impairment, that is, if a person is blind, you should start with your name. Tell your name first and then carry forward the conversation, because since they cannot see that, they may not able to recognize your voice sometimes, and whatever matter you are telling, that person will not be listening to that person will be figuring out at the point of time who is he that he is listening to. Okay, to avoid such a situation, it's important for you to start with your name first, and once he recognizes who you are, then if you start the conversation or put on a statement, he will then understand that and will respond accordingly. Okay, so that's another etiquette that you must follow. Having said that, let's move on to our next point, that is, if you need to leave a person who is blind, inform him that you are leaving and ask them if he needs anything before you leave. Okay, so if you are dealing with a person who is blind, okay, if you're dealing with a person who's a blind or a deaf person, tell them before you're leaving, okay, because that person may not be knowing that you left already, and that person may have any need, and later after you leave, he may suddenly realize that, and that time you won't be there, and that person may have difficulty attaining it or accessing it. So before leaving, let that person know that you're leaving, and before leaving, make sure that you give everything that person needs or requests for, okay. So that another etiquette that you must follow. After that, always avoid asking questions, personal questions, and to avoid individual who is differently abled, okay. So here we are using the word differently abled. So instead of disabled, always use the word differently abled. That's much more appropriate. That's much more appropriate and much more etiquette wise also it is good. Okay, so always avoid asking questions, personal questions, to an individual who is differently abled. You should not ask personal questions. You should not ask the things behind their disability or any kind of such things. So that thing should be avoided. Okay, you should not ask personal question to these people. After that, always give an additional time to a person with any disability to do or to say something. always give additional time. Just like you talk to everybody else and expect the immediate response or immediate action or reaction to whatever you say, don't expect the same from people who have different abilities. Okay, people who have different ability, please don't expect from them from that. Give them some time, let them give them some time to respond to that or process that and respond them time. So that's another etiquette you must follow. Always have conversation at a normal tone of voice. Don't talk in a high pitch to such people. Okay, anybody who has such problems, anybody who has any kind of disability or a person who is differently abled, don't make a high pitch sound, don't shout at them, don't raise your voice, don't speak at a high pitch. Always talk at a very low volume or a low tone. That will also make them feel comfortable and also will be appreciable by them. So that's another etiquette you must follow. And finally, you have, don't pretend to understand if you are facing problem in doing so. Now what will happen is that some people who have problem in talking, okay, now just because you don't want to disappoint them by telling you do not understand, you just nod your head. You just nod your head and tell that okay, fine, I understood everything. But the problem is that you should not do that, because if you do that, what will happen is that later if he asks anything related to that, you will not be able to answer. You will not be able to answer anything if he asks anything about related to that. That time, that person will realize that you were simply nodding your head and you did not understand anything. That time it will even disappoint him even more. So just because you are trying to, okay, I understood your intention behind not telling him that you did not understand it, but also understand that next time when he realizes that you nodded your head without knowing or without realizing what he said, he will be even more disappointed. So keep that in the mind and then take your actions according to that. But etiquettes say that you should not pretend that you understand if you don't understand. Okay, so that thing is extremely important. Having said that, let's move on to our next topic, that is advantages of physical education activities or physical activities for children with special needs. So what all are the advantages of physical activities for people or children who have special needs, okay, who have special qualities and special abilities and special needs? First is physical improvement. Obviously, it will improve their physical strength or physical health. Next, mental improvement. After that, their self-esteem will be increased or it will be boosted. It reduces the level of anxiety, stress and depression, and it improves and gives them the cognitive abilities or cognitive benefits, and it improves the social interaction or social circle. They develop a social health in that case, and better emotional and psychological health. It improves and it makes their psychological health much more better. It improves and makes their psychological health better. And later, finally, it reduces risk of health complications. So any kind of risk that they may have, any kind of health risk complication that they may have, it gets reduced. Okay, so having said that, let's move on to the next topic, that is strategies to make physical activities accessible for children with special needs. What all are the strategies that you should be taken to make this activity, physical activity, accessible for every children with special need? First thing is medical checkup. So medical checkup, if you conduct medical checkup, that way you will get to know what all problems a person has or what all problems a particular kind of kid with special need has, and you will get to know what kind of things to provide them and what kind of things to give them. Okay, so that's one thing. Second strategy is physical activity must be based on interest of the children. Okay, you should not restrict a child based on if that person's disability or if that person is differently abled. You should rather make that activity, you should alter that activity according in a way that a person plays that. For example, you have Paralympics where people play basketball in wheelchair. You might have seen that, right? So that person or the person who is disabled was not stopped from playing his important or his favorite sport. That sport was converted or altered in a form that person could play the sport. Exactly like that, even in schools, people who have any problem or people who have any kind of special need or people who have special ability as such should be helped with altering that sport itself and providing them that activity according to their particular need. Next, equipments related to physical activity should be according to the needs of children. So whatever equipments is required by the children, whatever equipments is demanded by the children, or whatever games what they want to play, that should be provided to them. Okay, so that is one important again strategy you must follow. Next is specific environment should be again provided. So like I said, you cannot mix those children with other children, because one thing is that if you are playing a sport again if you are playing a altered sport, other players must be playing the regular sport, then that also creates a lot of problems. So special facility should be provided. you should not put those person in a place where they feel any kind of disability, or they feel any kind of lack of any kind of talent in them, or any kind of movement in them or mobility compared to other people. So you should keep them in an environment where they feel better, whichever environment. Or some people may even feel better when you keep them with others, or you create an environment and indulge them with others. So depending on individual students, or depending on individual person who is having different abilities, you should ask them what that person needs. According to that, you should provide that. So that is another strategy you have. And after that, you have a variety of different instructional strategies that should be used. So different kind of instructions are given by different bodies, or different adaptive physical education bodies. Adaptive physical education is what? Adaptive physical education, you studied it, right? What is it? You have studied it in 11th standard. Adaptive physical education is an education where you altered certain activities of physical education according to certain children who needs that according to their particular physical disorder or mental disorder. Okay, so you alter certain physical activity, or you develop certain physical education activities that is particularly made for them. So such guidelines you should follow as a strategy for again helping or making the sports or physical activities accessible for children with special needs. Having said that, let's move on to the next one. Next is rules should be modified according to the needs of children with disabilities. Okay, so rules and regulations should be again modified according to the disability of a person. Like I said, you should alter the sports in order to make that adapted to the person, because obviously you cannot make the person who has a disability to adapt to the sport, right? Because of the disability, that is sometimes it's not possible for that person to do certain things in the sport, or certain skill that is required in the sports. So you eliminate that skill in that sport and make only certain skill that person can perform, and make that into a different form of sport or different category of sport. And such things you can do, such modifications you can do, or such modifications to the rules and regulations you can do to make it easier for children with special needs. Having said that, let's move on to the next strategy, that is children's previous experience must be taken into consideration. Okay, children's previous experience must be taken into consideration. Okay, what is it? Children's previous experience must be taken into consideration. That means if that person, or if a kid had a previous experience with a certain thing or a certain sports, that should be taken into experience, and that also should be polished and motivated among that children, okay, among that kid, so that performs and that boosts that person's confidence, and also it helps him to develop his activities, physical strength and mental strength more, and he performs better in the sports or any kind of physical activity, or does better in life. Okay, having said that, I hope you understood different strategies, different etiquettes, how to deal with people who have different kind of disability and disorder. I hope you understood different concepts and small little things that we studied in this chapter. Hoping you understood all the 3 sessions, the first session, second session, 3 sessions. And if you haven't watched those sessions, I recommend please go back and watch those episodes and watch them in sequence, in first, second and third session in sequence, so that you understand the whole chapter seamlessly without any kind of problem. So I hope you understood the whole concept very well. So I hope you understood everything from the concept of disability and disorder to the point where you study different types and how to manage that and how to deal with people who have such kind of problems. Hoping you understood all those things. I'll see you in the next session with the next chapter with a whole new concept and a whole new technique and a whole new tips and tricks. And until then, I'll take an off from here. This is me, Rohit, signing out. Until next time, goodbye.